Welcome to the broadcast. The topic for today is the viral pandemic, a critical incident stress management perspective. My name is Rick Barton, and I am the CEO of the International Critical Incident Stress Foundation. I came to the foundation in 2013 after a career as a medical and law enforcement responder and agency director. Joining me virtually for a discussion about the COVID-19 crisis is Dr. George Everly. Dr. Everly is a psychologist whose writings and teachings have greatly shaped the fields of psychological crisis intervention and human resilience. His work is recognized around the world, and he is a vastly experienced educator, trainer, author, and practitioner. He is also a co-founder of the International Critical Incident Stress Foundation. The experience and knowledge of Dr. Everly may be needed now more than ever. Dr. Everly, this pandemic seems like it is another one of those generation-defining disasters on the magnitude of September 11th. Are there any precedents for this?
Well, thank you, Rick. It's good to see you this afternoon. To your question, yes, actually, we do have some experience in this particular arena. We do know about the SARS that hit Hong Kong. We do know something, we are informed by the Ebola outbreak, the H1N1 outbreak that hit China and Singapore and to some degree the United States. So while COVID is truly unique in a number of ways, we still have some idea, we still have some history that can inform us moving forward.
Thank you. Listening to the news, this seems like a time of great confusion and contradiction. Are things really as chaotic as they seem?
I guess it really depends on what perspective you take in terms of are things chaotic or not. Certainly, if you listen to the news, which is 24/7, we certainly are inundated with reports. Sadly, many of them are conflicting. Part of that may be for totally legitimate reasons as the dynamics on the ground change. Some, sadly, may be for political or personal reasons. I'm not really sure. But we can be informed by history. Now, as chaotic as disasters seem, they actually follow a pattern from a psychological perspective. And what I mean by that is history has taught us that the psychological reaction to adversity, even on a great scale, such as we're seeing in any disaster, and especially the COVID-19, they actually follow a pattern, a predictable trajectory. And this is something that was first put forth by Zunin and Myers, and they proposed that there were phases. For example, the impact phase. The impact phase of the disaster is when the event begins. We're confronted with the threat. It is realized. What happens after the impact phase is we move into a kind of a heroic responding mode. And then hopefully what is followed is a honeymoon phase. In other words, we get on the other side, in this case, the other side of the epidemic, or in this case, the pandemic curve. And then where the field of disaster mental health really comes into play is in the next phase, which is the disillusionment phase. Now, we know that, and history has taught us, that psychological casualties, and what I mean by that is people whose lives are remarkably disrupted and they can't function the way they normally would. That's a psychological casualty. Psychological casualties far outweigh physical casualties, and the estimates are staggering, anywhere from 4 times as many psychological casualties as physical casualties to 50 times as many psychological casualties to physical casualties. And from a public health standpoint, we see that as the mental health surge. Now, that surge occurs in this disillusionment phase. Now, most of our efforts in disaster mental health and critical incident stress management specifically are helping us get from the disillusionment back into a recovery and psychological reconstruction, in plain simple English, moving on. So we do have these patterns, we do know this trajectory, and everything I've seen up to this point suggests that we're following that pattern precisely. The question that one may pose is, well, where are we? Well, this is interesting. This is unique to the COVID, more so even than the SARS. We, believe it or not, are still in the impact phase. We are morphing into the heroic phase. And when people ask, well, how long are we going to be in the heroic phase and the impact phase? Because that's the adrenaline rush. The question is, well phrased, well put. The answer evades me at this point. We just don't know. What I can guess is that once we hit the zenith of the curve, the high point in the curve of cases, that will be the beginning of a gradual decline in the heroic into the honeymoon phase, and then that will be followed by the disillusionment phase.
Just a quick follow-up question, Dr. There are some projections that this will be seasonal, it will fade at some point, and then come back again in the fall or winter. Would you predict or project that the phasing would start over? And I know that depends on where we are in that phasing when, and hopefully soon, this fades. Again, what would you project might happen if it starts again in just a few months after it has calmed down?
That's a great question, which actually no one's ever asked me before. So I'm not a virologist or an epidemiologist, so let's go with the notion that there is a likelihood that we may repeat this in a seasonal manner. If that is the case, from a psychological standpoint, I will tell you, it portends a difficult course because people will have moved on. And to think that this is happening all over again can be remarkably exhausting, as well as very demoralizing.
Thank you. What reactions do you view as likely unique to first responders and also the medical providers, who seem to be not just medical providers, not that that's not enough in itself, they also seem to be fulfilling the role of responders. But what reactions do you see as unique to these groups of people?
One of the things that I hear over and over again as I consult with healthcare facilities around the world as this is going on is a concern for the personal protective equipment. While many people are experiencing shortages, many are not. But even those who are not are anticipating the shortages, and this is creating stress. So one of the first things that is disconcerting from a psychological standpoint is, will we have enough PPE? And if not, what do we do then? One of the things that we find already happening is first responders, healthcare professionals are very concerned about being infected and then bringing this home to their families. I've heard literally of cases where healthcare professionals, first responders, will come home and they will literally live in their garage, if they're fortunate enough to have one, for fear of contaminating the rest of the family. So contaminating your family, your loved ones, is a very, very significant concern. One thing I wish I didn't have to mention, but we're already seeing some evidence of it, is stigma. It seems that we've gotten reports that healthcare providers, first responders, are in some instances being almost ostracized in their communities. And this is very, very disconcerting. Back in the dark ages, social distancing and ostracization actually worked as a public health strategy. It does not work now. In fact, the more we use stigma, which is designed to separate one group from another group, the greater the stigma, the less likely that people will get tested, the less likely they will get early treatment, the more likely they will maintain a contagious state for a longer period of time without treatment or some sort of intervention or isolation, and a greater likelihood that they will develop a more severe variant of the illness. None of these things are in anyone's best interest. So we've even seen very hostile hashtags targeting people who have caught the infection, in this case, the COVID-19. This is a time to rally together. The enemy is the virus. It's not the people that carry the virus.
That's excellent. Thank you. CISM, Critical Incident Stress Management, is the world's only integrated and comprehensive continuum of care that focuses on fostering resilience during and after trauma and disasters such as this pandemic. What is the CISM perspective on this pandemic?
As you mentioned, the critical incident stress management is the most widely used strategic planning system for disaster response in the world. One of the things that makes it unique is it's an integrated, comprehensive spectrum of interventions. In physical medicine, healthcare, we talk about a continuum of care. So too must we consider a continuum of care, especially given the phasic nature of psychological responses I've already described earlier. So critical incident stress management is the only model in the world that has a complete continuum of care. Where we are right now is in the reactive intervention aspects of critical incident stress management. The core competencies, the core interventions of CISM revolve around the ability to do surveillance, psychological triage, the ability to do one-on-one crisis interventions, not as cures, not as therapy, not as replacements for therapy, but designed to stabilize and mitigate acute distress responses. We can certainly do that virtually, as we are doing this presentation. The ability to do small interactive groups, large group briefings are also core elements of critical incident stress management. Now, however, these must be done virtually in most cases. But it, again, lends itself to adopting this new virtual reality presentation, thinking outside the box. Briefings are very easy to do telephonically and by various email, even email, text messaging kinds of ways, or by fora such as we are using now over the computer. The interactive small groups will be more challenging. So the people who have been trained in the continuum of care, I think, are uniquely positioned to think outside the box and respond to a crisis, the nature of which we have not experienced before.
Thank you. Additional information on the Foundation's website is available at www.icisf.org. And this includes links to Dr. Everly's work, a smartphone app that also includes some of his work, and other resources. If you look, you will find a steady source of information and contacts via our social media pages as well. Dr. Everly, before we conclude, do you have any additional comments you'd like to share?
Darwin told us many, many years ago that groups that are cohesive do well in adversity. They do far better than groups that are divisive and non-cohesive. This is a time to set aside our personal and political differences. This is a time to come together. This is not a time to seek political, financial gain. This is a time to realize we are all in this together. As a cohesive group, we maximize the likelihood that we come through this as effectively and efficiently as possible. That having been said, we are going to experience illness and death on a scale, if the virologists and epidemiologists are correct, unlike we've experienced before. This will challenge us psychologically. Now, more than ever, we need to rely on psychological support models. We know the single best predictor of human resilience is the support of other people. This is a time to realize the threat, as I said before, is the illness, not the people that carry it. Let's listen to their voices, especially the voices of those who recover and can inform us how to move forward. There will be many lessons learned at the end of this. As you say, it may happen again. We will be better prepared if it does. But using the CISM continuum of care, in my opinion, is the absolute right way to think through how we align our resources now and in the future.
Thank you, Dr. Everly. Everyone, please remain safe, follow the guidelines that are provided by professionals and leaders as we work together to manage through this crisis. Good day.